Seth Donnelly. I'm 25, and I'm a freelance videographer, TV production.
Seth works on a freelance basis for various television productions, including a few at the 9 Network. But his main gig is working as a drummer.
Yeah, I started playing drums in high school, and always just for fun. Played in bands here and there, and never making money or anything. Then I got in Dance Floor Riot and realized that I could actually make a decent living playing drums. We've been together for like 4.5 years. I put a lot of money and effort into drums. I don't have a weekend life anymore. I play shows every weekend. And people think that, oh, you're playing drums, you're having fun, you're playing. And it is fun sometimes, but I mean, it's a job. It's every weekend, every Friday, Saturday, I'm working from 5 p.m. till 2 in the morning, playing drums, getting loaded up, loaded out every weekend. I've been working at this really hard for a long time, and finally starting to get there.
Like many self-employed Americans, Seth does not have health insurance. And why is that?
I can't afford it. I'm in a position where I don't, my 2 jobs, being a musician and a freelancer, I don't have benefits. I don't have people offering me anything.
While not having health insurance hasn't been an issue, Seth's a pretty healthy guy with the exception of the occasional cold, he does have his concerns.
I have family that have been in accidents and not had health insurance and are going to be forever in debt. So there's always that fear of if I get in a really bad accident or something like that, I'm not covered.
So Seth is going shopping at the health insurance marketplace in hopes there is some kind of plan he can afford. Available to those under the age of 30 or those who meet the financial hardship exemption is the catastrophic plan. It's a safety net. If he's in an accident or blows out a knee, he'd be covered. This plan offers the lowest premiums with the highest deductible. As the plans improve, premiums increase and out-of-pocket costs decrease. The Bronze plan covers 60% of all healthcare costs. The Silver plan, 70%. Moving up to Gold, you'll find the highest monthly premiums, but lowest out-of-pocket costs with 80% covered. There's also a Platinum plan, but that's not available in Missouri at this time. So here's the deal. All plans must meet a minimum standard of coverage, and there's a few big changes. You can't be denied because you have a pre-existing health condition, and you won't be charged more because you're a woman. However, you will be charged more if you're a smoker. So if Seth does buy insurance through the marketplace, he's not buying insurance from the government, rather private insurance companies, and he'll receive a bill from them just like he does his cell phone provider.
I kept trying to log on. I would get to pretty much the same point every time, and then it just frees up.
A week after Seth tried shopping on the online marketplace and failed, he decided to go at it from a different route.
I just got to work and getting ready to start my shift, and so I'm going to call this 1-800 number and try to get some health care.
Welcome to the Health Insurance Marketplace Call Center. How can I help you?
I'm calling about getting some health insurance.
And what state are you calling from?
Missouri?
To set up an account in the marketplace and determine what, if any, discounts an applicant is eligible for, one must provide a social security number or document numbers for legal immigrants, employer and income information, policy numbers for any current health insurance plans, and if applicable, a completed employer coverage tool, a document that can be downloaded at healthcare.gov. Seth spent about 20 minutes on the phone with an operator submitting his application. Once it's processed, he'll receive an email explaining his health insurance options. And for Seth, just getting the ball rolling is a step in the right direction.
Thank you for calling the marketplace, and you have a good rest of the day.
All right, Seth, so it's been a week or so since you called the health insurance marketplace on the phone. Where are you in the process of getting health insurance?
The same place I have been. Nothing's developed. I haven't gotten any information.
So you haven't been contacted? Hey, your application is processing, nothing?
Mm-mm.
You still want health insurance, so how's this waiting game?
It's a bummer. I don't know. I didn't think I'd be able to afford it in my 20s at all. And now that it's right there, I'm anxious to figure out if I'm going to actually be able to afford it.
Yes, sir.
Seth is one in about 800,000 uninsured Missourians, many of whom share the same frustrations about the marketplace. So Seth gave the calculator found on the Kaiser Family Foundation website a try. Go ahead and plug in your stuff.
Is that it?
Mm-hmm. So down here it gives you your results.
Okay. It comes out to like $96 a month, which is way more affordable than I thought it would be. I was expecting at least a couple $100.
You're not going to be able to sign up for it until the kinks get worked out on the website. After we're done talking here, are you actually going to follow up with this?
Now that I know it's a realistic thing, I'm definitely going to get it.